Over the past year with COVID, we've seen the massive interactions between nurses and patients and how nurses use their knowledge to care for them. We can see how much value there is in the role of nursing and the potential nursing holds for the future. We are not the only ones to notice this, as hospital employers also realize the future impacts that the nursing field can have on our society. The realization that nurses are the future of primary health care changes not only how our communities are cared for, but who is providing care for our communities? As a nursing student and someone who is shadowed in hospitals, I've had conversations with employers that say that they see nurses with more education continue to provide better care and want to expand on the field because of that factor. They recognize the kind of care that is offered by educated nurses and want to make that the new standard. In the field of nursing, there will be an expectation of higher education. Today, I'll be talking about the better care educated nurses can provide now and how that will influence the field in the future, and also how changing factors in the healthcare field in general are pushing for nurses to obtain higher education. Now, let's begin to understand the future of nursing. Nurses with higher education will provide better care for patients. It has been proven that as more nurses enter the field with degrees, this lowers the risk of death for patients. On February 26, 2014, a year long study was released by the National Institute of Health reports that for every 10% increase in nurses with a BSN or a Bachelor of Science in Nursing, the risk of patient death goes down by 7%. This can be shown on the slide right here. And with this information, we know that more educated nurses have more knowledge to use to help their patients, meaning that we're able to provide more efficient healthcare in the future. It has also been proven that with a BSN, statistically, it improves a patient's hospital experience beyond the risk of death. An article released on November 10th, 2014 by the University of Michigan discusses a study conducted by a university professor, Dr. Olga Yakisheva, exploring the impacts of a nursing degree on the experience of a hospital patient. Reports show that if a nurse with a BSN administers 80% or more of the patient's care, their hospital stay will be lowered by 2% and the odds of the patient's readmission is reduced by 19%. This can be shown on the slide right here. With this understanding of the study, there is a desire to increase these statistics to improve healthcare, and hospitals will expect their nurses to have higher education to better care for patients and make that the new standard. Now that we've talked about nurses providing better healthcare and their own role, how can nurses go beyond the stereotypical role in healthcare? Nurses will begin to hold more responsibilities of being primary care providers as they achieve higher levels of education. With a predicted shortage in physicians, nurses will be encouraged to produce higher education to gain full practicing authority to become nurse practitioners and fill in the gap of physicians. According to a survey, about a third of physicians are nearing retirement age, meaning that there will be a shortage of doctors within the next decade. AAMC 2019. Nurse practitioners will be in high demand and will be encouraged by employers because they have the same practicing authorities as doctors, but they have less schooling. With nurse practitioners being growing and being in high demand, they will enter the workforce faster than most future doctors. According to a journal, current physicians are retiring the next decade, and the number of medical students and residents returning or entering the primary care workforce is currently declining. NCBI 2011. The number of nurse practitioners, in contrast, is rising, and they're entering the workforce faster and can provide the same care as a doctor. This is all possible because of their elevated education, and it will be a driving force for nurses to be pushed by their employers to gain higher education. With all this information in mind, you may wonder, how can we come together to understand the whole picture of the future of nursing? In the field of nursing, there will be an expectation of higher education. We have come to see how education will enable nurses to continue to provide better care for their patients, both in their typical healthcare role and when they're able to take on more responsibilities. Hospitals realize the potential that nurses have and want them to use all of their knowledge to the fullest extent. Hospitals want to ensure that the time spent between nurse and patient are most beneficial and productive. They recognize that hospitals can achieve higher standard of care by elevating the expectation of knowledge that nurses possess. To, to elevate the standard of healthcare our communities receive, hospitals understand that the expectation of education for our nurses will also have to be elevated.